And here we go. Welcome everybody to The Big Idea. I'm Dr. Jeffrey Hanna here at Clear Chiropractic. Today we are talking about brain fog, whiplash, and the sensation of pressure inside of your head that can trickle down. It can cause you to feel off balance. It can cause you to have a headache. It can make you also feel like you have tingling in your hands and also low back pain. We're talking about a condition that's known as degenerative cervical myelopathy. In other words, irritation of the cord inside of your neck. And what we're going to look at are a few things that relate to MRI imaging, things that oftentimes are not diagnosed by the radiologist. And the reason for this, radiologists are trained to look for broken bones, dislocations, tumors, like the big stuff. But what I'm going to be showing you here are small things that in and of themselves, they're not a problem. But when you start to look at them as a whole, especially if you are feeling all of these symptoms, that these little things can actually make a really, really big difference. So I hope that you enjoy this video. If you don't currently like and subscribe to the channel, please do that. And if there's value in this video, please share it with other people who you think could benefit from it. Let's go ahead and jump into it. All right, we're going to start with one of my favorite slides to be able to show people the nature of what actually happens with your brain and your spinal cord. We oftentimes think of it as being just this static thing that sits inside of our skull, sits inside of our spine. That is not the case. Let me show you this. So on the image that we have over here on the left, this is more in line with the traditional MRI is going to show. But over here on the right, we have what's called a phase contrast MRI. This is where it's taken in multiple sections and slices so that you can see what is actually happening. And I want to point out two things right here. Number one, you see that your brain and your spinal cord here, it actually moves with every single beat of your heart and with every single breath that you take. The cord actually oscillates up and down, normally about 1 centimeter total in the middle part of your neck. Now, I also want to illustrate then all of this white stuff that you see on both of the images. The white stuff is what's known as cerebrospinal fluid. It is what bathes and cushions and protects your brain. It is also intimately involved with being able to supply energy, oxygen, and other electrolytes, small particles, so that your brain and your spinal cord can actually work the way that they're supposed to in being able to transmit information down to the body and ultimately up to the brain. What a good chunk of the research is showing these days is that if you have anything that is disrupting cerebral spinal flow and this ability for that to be able to circulate around your neural tissue the way it's supposed to, this is going to be what's associated with all kinds of different forms of pathologies. Like I had said, the dizziness, the headaches, the heaviness in the head, but also issues in the upper extremities and also in the lower body. So we're going to jump into so I can explain a little bit about exactly why that is. Here's a bit of a mouthful for you. The role of the glymphatic system in cervical spondylitic myelopathy. Insights from advanced imaging. Let me translate this into English here. So firstly, I'm going to say cervical spondylitic myelopathy. So cervical is referring to the neck. Spondylitic means degenerative arthritis. It has nothing to do with the person's age. It is where there has been some kind of physical trauma, either something that happened a long time in the past or repetitive stress injuries that build up over a period of time, like the accumulation of rust that you've seen on a bike that's been left outside in the rain for a few days versus a few months versus a few years or decades. It accumulates over a period of time. And what it can do is it can start to slowly erode so that there is less functional space for nerves, for muscles, for ligaments, all that sort of stuff to be able to function. As a consequence of that, people start to experience symptoms. And if you have an issue in the neck, it is not limited to just neck pain. In fact, some of the more common symptoms associated with this are going to be tingling into your hands, what sometimes is diagnosed as a carpal tunnel syndrome. It can also be pain down into your low back, where persons had all the general chiropractic, the physical therapy, the exercise, the injections. You're doing all of the right stuff for your back, but this might be a transmission error because of an old injury to your neck. It can also show up, curiously enough, as bowel bladder dysfunction, because again, this is a transmission error. So these are the sequence of events in terms of what's called this cervical myelopathy. Very common down the track for people who have experienced whiplash injuries at some point in the past. And other literature talks about this as being a slow motion injury. In other words, it doesn't always have to happen immediately following some kind of a trauma. It can show up years or decades later if you've not gotten the right kind of treatment. Now, the second thing I need to translate for you is the glymphatic system. What is glymphatic? Remember that white stuff, that cerebrospinal fluid that I showed you on the previous slide? Well, what that is referring to, glymphosis, is the process by which the fluid inside of that space is actually able to get into and also out of the neural tissue. And every single component of it is all about fluid pressures. Basic physics is that fluids move from areas of high pressure to low pressure. And as far as your body is concerned, highest pressure is going to be arteries. Next, you're going to have that CSF space. And last, you're going to have veins. So that is going to describe the normal flow of fluids, electrolytes, things like that, the nutrition that your brain needs. The problem is that if a person ever has a physical condition or a metabolic condition as an alternative, what it can do is it can actually cause a reversal of those pressure gradients. So instead of fluid being able to flow properly, what it does is it starts to backflow. You've got congestion of the veins at a micro and at a macro level that in turn can flow back into that cerebrospinal fluid that can in turn lead to some type of artery insufficiency. My point being there is that when this process happens, the brain and the spinal cord itself are not going to receive the right amount of energy and also nutrition that it needs. And as a consequence, things are not going to be working properly. And this phenomenon is starting to be recognized more and more for people who have had those whiplash injuries, the concussions. There's no evidence of overt trauma on their MRIs. But if you see evidence of a disruption of that white fluid, then that is a sign that the brain, the cord itself, are not healthy. And this is a subtle sign. Again, just because you don't see broken bones on an MRI or a tumor or a giant lesion or anything like that, if you've got a disruption to that flow mechanic, that is going to be a big deal. So what are these researchers looking at? This is just some preliminary research where the objective of this study to provide a primer of the glymphatic system, discuss its potential relevance in evaluating spinal diseases like cervical spondylitic myelopathy, and describe possible imaging markers of the glymphatic system derived from a bunch of fancy types of MRIs. And even though this is pretty preliminary research here, they did a study of 42 patients with mild, moderate, and severe symptoms. What they found was that the pathophysiology of cervical spondylitic myelopathy may affect the glymphatic system because of chronic spinal cord compression that, and here's the important part, decreases CSF bulk flow, leading to compensatory increases in interstitial fluid flow. So I jump back to this particular slide. What that means is that, simply put, this white stuff, if there is not enough functional space for it to be able to flow, this could be a biomarker, a sign that a person's neural tissue is not receiving oxygen, energy, water, all the stuff it needs to function, and this might be one of the mechanisms by which people start to experience problems. And this will be important on a couple other slides I'm going to show you very shortly, is that even if you do not have overt compression of the spinal cord, of the brain stem itself, if there is not enough of that white space surrounding that area, that might very well be what the actual problem is. So I jump ahead to another little research one. Intramedullary stress and strain correlate with neurological dysfunction in degenerative cervical myelopathy. In brief, the picture that I already showed you, that's where a person's head is in a neutral position. However, the fluid dynamics on the inside change when we do these movements with our head. And if we're doing it for just a few minutes at a time, no biggie. However, if you're dealing with degenerative arthritis, a whiplash injury, or things where simply put, the vertebra of the spine are either moving too much or too little, what that can do is that starts to lock the neck into abnormal positions, and it would be as if your neck is always locked in this kind of a position right here, or it's always locked in a position like this. You get the idea, and that changes the fluid dynamics on the inside. So again, this was a relatively small study, 20 patients. So again, we're just collecting the evidence on this, but showing you what is possible. Patients with severe degenerative cervical myelopathy exhibited significantly greater stress during flexion than those with mild to moderate disease. These findings underscore the impact of dynamic spinal cord mechanics on neurological dysfunction and support their potential utility in improving degenerative cervical myelopathy diagnosis and treatment. So if you're seeing evidence, and this is the case of a whiplash injury, anything where the head and the neck snap back and forth like this, it does not have to be a car accident. This can be an old sports injury. This can be a roller coaster. This can be bungee jumping. This can be a trampoline. This can be headbanging in a heavy metal concert. Whatever it would be, is if the neck is subjected to that kind of a force, that is going to lock it into the wrong position, and as a consequence, that slow motion trauma over a period of time can start to affect the circulation of things on the inside. And then that is the equivalent, your neck is stuck in this position all of the time. Now, what I want to show you here are a sample of a few MRI scans of a case I was asked to consult with recently. And this is not meant to diagnose the individual, and this is also not to diagnose you who are watching this video either. However, it's been my experience that when people have been to doctors, when they've been to all of the specialists, they've had all of the tests, but nobody can figure out what's going on. Again, oftentimes we're looking for the big things. I want to show you some of the subtle signs that may explain what's going on, because this is the stuff that the research is now showing. We need to be paying more attention to this. So this is a young gentleman who's been experiencing everything that I've already talked about. Heavy head, constant brain fog, constant neck pain, lower back pain, had all of the tests. Nobody can figure out what is what. So let me point out a few things here. So number one, on the scan, you can see base of the brain down through here. Here's the balance coordination center. It's called the cerebellum. And you might see that it's sitting actually relatively close to the base of the skull. This is a phenomenon that's known as cerebellar crowding. It can be like you're trying to fit your foot into a shoe that's one half of one size too small. You can still do it, but it's going to be a little bit uncomfortable. And that can affect and essentially act like a cork in a wine bottle, prohibiting the flow of that white cerebrospinal fluid here. And as you go down, you can see cord going down just like this. Now, let me point out a few things here for you. Number one, this is definitely a whiplash injury because normal curve of the neck should be forward facing. So a nice smooth arc like this. This one is more shaped like an S, or in this case, because he's facing that way, this would be shaped more like a 5. And as you come down, I want you to pay attention to this. Look at how much functional space there is for all of that white stuff. There isn't very much. Not on the front or on the back. So as that cord would be oscillating up and down like this, there's not going to be very much space for that fluid to flow. And even though the nerves are not showing and the cord is not showing signs of compression, there's not enough space right there. The consequence of that is that he can be experiencing the exact same kind of symptoms, but he's been to all the specialists. They say there's no evidence of nerve compression. What they did note, if you see this white speck down through here, this is what's called a syrinx. This will sometimes show up in people where it's the accumulation of fluid on the inside of the cord itself. Evidence that we are dealing with abnormal pressure of that glymphosis, of that system where fluid can get in, but there's not enough for it to go back. And so as a consequence, it builds up, in his particular case, on the inside of the cord itself. You might also notice that this area, as you come down right through here, it starts to look a little bit wispy. And you look at that white stuff up here, I mean, that is bright white. But as you come down here, you might notice that's actually looking more like shades of gray. That is signs of what's known as cerebrospinal fluid turbulence or an obstruction. Do you remember where we talked about on the previous little slide there, where we said that there's CSF bulk flow? That's referring to the massive flow of fluid. Well, if there's ever a decrease in bulk flow on an MR, it's going to start to produce these little wispy, wavy motions. It's sign like an eddy or an abnormal current in a flowing river. So even on this MR, we're seeing, yeah, there's some evidence of that, and definitely way too little functional space through here. But this fellow, because at least the specialists were being thorough, they also did flexion extension MRI. So let's have a look at that flexion image that we have right here. So he is now leaning his neck forward. Number one, as you can probably see, is that kink, that curve in his neck, it just gets even worse. Not only do we not have near as much of that white fluid flow along the front, but you can actually see that there is subtle signs of indentation of the cord itself right through this area here. And again, you don't see signs of overt compression here, but you do see this subtle indentation. His MR came back as saying, nope, that's not going to be significant. But again, look at the little pieces here. And when you start to add them up, understanding that the cord actually moves up and down, that if his neck is locked in this kind of position and it's rubbing up and down like this, I can do that on my hand, no problem, for a few minutes. But you can imagine if I'm doing that nonstop every day for years or decades, that is going to be like giving a little bit of a burn on my hand. Water torture test. But in this particular case, it's happening on the inside. They also did an MR scan where he's going into extension. Okay, good. In extension, there is a little bit more of that functional space in the front here, but now you see the exact opposite problem. When he brings his head all the way back, then it starts to produce a little bit of abrasion or friction against the back elements right through here. So now there's not enough space for that fluid to go on the back side. Now, of course, you also cannot diagnose this stuff just looked on one side view. So what we have right here are top-down views. So this here would be left side, and these are at two different levels of the spine so that I could illustrate. So the white halo that you see right here, that is the space for the cerebrospinal fluid. And the dark thing, kind of the ovular thing that you see in the middle, that would be the spinal cord itself. And whether you're looking here or here, you'd see, you know, there's not major indentations on any part of the cord. But have a look at how much space there is at this level of the spine versus here. It is much smaller. That's what the issue is. If there is less space for that fluid to flow, that's going to affect the glymphosis, that's going to affect the CSF bulk flow, and that, like in the research that I showed you, can be one of the major contributing factors for why people experience this pressure, this pain, even in distant part of their bodies that they actually are. Question now is, what do you do with this? As much as I'd like to say that, oh, well, here's the one magic solution, unfortunately, it is not that easy, because when we do have degenerative arthritis that has set in, there's not going to be any solution for that. It's more a matter of how do you achieve normal stability, how do you achieve normal motion, and how do you increase that function to the highest possible level. And there's not a one-size-fits-all solution here at all. So certainly one aspect is you want to make sure that the joints of the neck are going to be moving the way that they are supposed to be. If a joint is moving too little, this is where upper cervical specific chiropractic can help. This is not the same kind of thing as twisting, cracking, popping the neck. No, it's recognizing, okay, we need to be very, very subtle here, but then also very precise in our approach. No twisting, no cracking, no popping, making sure that any adjusting procedure is going to be specifically tailored for you so that it can restore that normal motion. Now that's if you're dealing with something that is not moving enough. If you are dealing with something that is moving far too much, perhaps you're dealing with the cervical instability, this is where musculoskeletal medicine shines. This is not just cortisone injections to decrease the pain, but these are actually peptide injections to help to strengthen the ligaments so that you don't have excessive mobility of the different joints. And oftentimes what you have in most people is you have this combination. Some joints are moving too little, other joints are moving too much. Very important then to differentiate between the two. And oftentimes it needs a multifactorial approach. In other words, again, there's not a one-size-fits-all solution. If you're also dealing with extreme instability, as much as people don't like the idea of neck surgery, surgery is sometimes necessary to help to stabilize these things so that that fluid can flow without turbulence the way that it's supposed to. And of course, what do you also need to do? You also need physical or occupational therapy to make sure that you are moving your neck the way that you should. So exercises target to help strengthen your neck, but also making sure that you are not accidentally or deliberately doing the exact same kinds of repetitive stress movements that are just only going to make these conditions oh so terribly much worse. So usually it is a multi-factorial approach, a team approach, rather than a one-size-fits-all. I'd love to say, yep, here's the magic solution for all of these things. Truth is there are a lot of moving pieces with this. But between specific chiropractic care to make sure that things not moving well enough can move the way that they're supposed to, musculoskeletal medicine, making sure that things that are moving too much are actually able to stabilize, taking in surgery if that's required, and then also physical exercise to make sure you are using your neck the way that it's designed. Every one of these little pieces can go a very long way to help improve that flow, improve that function, and ultimately increase your overall quality of life. So a little bit heavy topic there, but like so many of these, a superficial little glance, it's not sufficient to really explain what's going on here. And hopefully by taking the time to show you some of the things on these MR scans, it will be useful. If you've had scans, things that you might be able to identify even on your own, or asking your docs or your specialists, hey, this might be a little bit of something that's going on. Do you think that this could be contributing? So again, I hope you enjoyed this particular video. Please do share it with your friends and family members if you think they'd benefit from this. And also again, make sure to click that like and subscribe button. That way it helps this video be found from other people who are looking for solutions to their various kinds of problems. If you want more information or to reach out to us, you can find us at clearchirospokane.com, where we have all kinds of other videos, blog articles related to the health of your neck so that you can ultimately improve your quality of life. Thanks again for watching. This is Dr. Jeffrey Hanna at Clear Chiropractic. Get well, live well, stay well.